All right, thank you, Jason. And I'm here with Dr. Loren Anderson. He is with Anderson Dental here in the Tri-Cities, and we're talking about oral cancers this morning. Some pretty startling statistics on this. Is this something that we're seeing more of?
Actually, oral cancer rates have been increasing in healthy individuals, individuals with otherwise no risk factors, the common risk factors being tobacco use, alcohol use, and we're seeing more cancers in people without those histories.
Yeah, actually, HPV is a big cause of oral cancers these days.
HPV, which women are more familiar with for cervical cancer, is strongly associated with numerous oral cancers, and especially throat cancers.
Okay, so tell me about diagnosing something like this, because a lot of people, they may not recognize what oral cancer truly looks like.
That's the scary part of oral cancer. Initially, it looks fairly benign, fairly minor, but when caught early, the survival rates are 2 to 3 times higher.
Right.
So, it could just be a lump or a bump on the gums, in the cheek, a sore throat, and a lot of times people just ignore these things.
Right. So I guess the best advice then would be to go to your doctor, go to your dentist anytime that you see something that's out of the ordinary. Tell me about early detection then. What's the outlook on something like this if you catch it early compared to later?
So early detection, typically when it's localized and it hasn't spread to regional or distant sites, your survival rates over a 5-year period are 80% and upwards.
Okay, so pretty good. Are oral cancers, are they some of the cancers out there that do spread more easily than others?
It's not so much that they spread more easily than others, but because they typically go without detection longer, they become more severe. I just read this morning in the paper that Tony Gwynn's battling oral cancer again.
Okay.
So it strikes young, old, rich, poor. It doesn't discriminate.
Right. Now, if you're someone out there who is in need of a screening, maybe you don't have insurance, you're underinsured, you're actually offering some free screenings coming up here. Yeah,
April is Oral Cancer Awareness Month, and so next week we are offering free screenings in our office. People just need to call, they can come in and we'll do a free screening to evaluate for oral cancer. Otherwise, if you have a regular dentist, dental checkups, the dentist is going to be checking and screening for oral cancer.
Where are you guys at, and what's your phone number?
We're located on 24th in Kennewick off of Union. Our phone number is 585-2500, and they can call anytime, 8 to 5, and request a screening.
All right, great. Thank you so much for being here today. We appreciate it, and we hope anyone out there who needs an appointment can set that up. And we'll be back in the kitchen with Fox and Bear Public House.